Welcome everyone. Welcome to today's community awareness webinar, COVID-19, all you needed to know. My name is Aditi Soni and I'm president of United India Association of New England. Today's event is brought to you by our team, UIANE team, working in close collaboration with IAGB and Iman. As you all know, COVID-19 pandemic has impacted millions of lives around the world. And thanks to our scientific community that we can now see some light at the end of this tunnel. Many companies are coming out with COVID-19 vaccines in record time. In Massachusetts, we are in phase 2 of vaccination. And with the availability of vaccine, we have many questions on our mind. So today, we hope to address your questions with 3 distinguished panelists. Our first speaker and panelist is Dr. Malini Prabhu, a board-certified psychiatrist at Newton Wellesley Hospital and an assistant professor at Tufts University School of Medicine. Dr. Prabhu is also Vice President for United India Association of New England. Then we have Dr. Asif Merchant, who chairs the Geriatric Committee of Massachusetts Medical Society and has served as the president of the Greater New England Society of Post-Acute and Long-Term Care. In September of last year, Dr. Merchant was appointed to the Governor Baker's advisory group for COVID-19 vaccination in Massachusetts. Our third panelist is Dr. Kosha Thakur, who is Chief of the Division of the Palliative Care Services and Director of Diversity, Equity, and Inclusion at Newton Wellesley Hospital. She is also Clinical Assistant Professor of Medicine at Tufts University School of Medicine. Last but not the least, I would like to introduce my co-moderator today, Dr. Seema Gupta, an internist in Boston area, who also serves as Secretary for Iman. Dr. Gupta.
Okay, hello everyone. Thank you so much, Aditi, for the nice introductions. And I want to welcome everybody on behalf of Iman for this fireside chat, indeed a fireside chat with all the burning questions about the COVID-19. So with this, I really want to thank all the panelists who have taken their wonderful, knowledge to come to this. They have given their time and come to this presentation today. With that, I will actually take the next remarks to be given by Dr. Prabhu. She can open up the podium with questions.
Thank you for this opportunity. I'm going to show some slides and followed by questioning. This is me getting second dose of the vaccine. Next slide, please. So I have no financial interest in any of these things today. And the COVID-19 vaccine and the rollout is kind of a dynamic. And a content in this issue we discuss is valid up to this point only. Next slide, please. So we know CDC has, FDA has approved 2 vaccines, Pfizer and Moderna. Both are mRNA vaccines. And there are 2 doses. Pfizer is first 1 dose and on 21st day, 2nd dose. Moderna is 1 dose first day and on 28th day or 29th day, 2nd dose. The difference is the storage issue between those 2. Pfizer requires, you heard, there's a lot of ultra cold storage for Pfizer. Moderna, regular cold storage. And the difference between vaccination is Pfizer approved for 16 years and older, and Moderna is 18 years and older. So this information, all this information is on CDC Center for Disease Control. So most of the information is from there. Next slide, please. So a lot of my friends and colleagues asked me, especially my community people, whether these vaccines have eggs, preservatives, latex, and the blood products like beef and pork. I'm just pleased to tell you that these vaccines do not have any of these products. It's just an mRNA genetically modified one. Next slide. Next slide, please. Can you go back, Sanjay? So this is most common side effects. Everyone might have heard already. The pain at the site of the injection, some redness and swelling, especially with the second dose, we have noticed. And some people get little light chills and tiredness, headache, and some myalgia or body pain, which might subside within 24 to 36 hours. Next slide, please. So another question came up many times is why do we need to take vaccine? What is herd immunity? If you look at the picture, that person on the right side, no herd immunity. The red bigger person is the person who's infected, and the person around him are in blue are susceptible to the COVID infection. If you can see that in picture, that single person has transmitted to around 9 people in there. If you go on to the next picture on the right side, the person is immune. The green people are been vaccinated and they're immune. So they're unlikely to transmit to this single person is unlikely to transmit to so many other people, and they might kind of has a kind of nice barrier around this person. That way it is not transmitted. As we know, with a lot of vaccines like polio and measles, mumps, it is known that around more than 70 to 75% coverage is required to get this herd immunity. And CDC has some remarks on the how much it is required for a COVID vaccine. You can look up on that. Move on to next slide, please. So this is the information. I got it from mass.gov.com. This exact information is there on the mass.gov. So there are 3 phases which are Massachusetts doing the vaccination. Phase 1, which is started from December to February 2021. So there are several groups in that who are getting vaccinations. So first responders and doctors, and there is a criteria who gets that vaccine. And there is a phase 2. We are currently at phase 2, and 75 plus are they can call up and get the vaccination done. That's going to last from February to March. And the phase 3 is starting in April. That should cover most of the public population. Again, I put the link here. All this information is on mass.gov. Next slide, please. So again, I wanted to say, I'm sure all of you are looking to be here. I want to be there lying down next to the beach, and I guess everyone is. So hope we will be soon able to do that. With that, thank you for giving me this starting presentation, and we can start questions, move on to questions. Thank you.
Thank you, Dr. Prabhu. Yes, we all want to be there, right? It's more than a year we have taken any vacation, but as I said, we are getting there. And let's educate ourselves and hear from all these experts why vaccination is important and all the questions you guys have submitted through the registration link. And please note, you can submit your questions in the chat window and we will address them as we go. For people who are joining a little late, just a reminder that this is a community awareness webinar organized by United India Association of New England in collaboration with Iman and IHEB. Please note that this webinar is for educational purpose only. Things are changing every day, and we strongly encourage you to consult your primary care physicians or healthcare provider for any medical advice specific to your needs. Thank you so much. With that, I would like to get started with questions we have received through our registration link in Zoom. Dr. Prabhu, if you could address um, when and how do I know if I'm eligible to get the vaccine?
So in terms of how, I know your healthcare provider, primary care physician, or whoever rolling out vaccine for you should be able to help. And you would contact your primary care physician, or many of us have, many of you might have a health portal. Through that, you will get a message saying that when you will be able to get this is how and when. According to the phases I described earlier on mass.gov, there's a phase 1, phase 2, and phase 3. So we are almost reaching the phase 1, and again, phase 2 has started. So hopefully, depending on that, you will receive a message from your primary care physician and you can get that information.
Okay, thank you. Thank you so much, Dr. Prabhu. So this is Dr. Gupta. So my next question is actually to Dr. Merchant. And now that we know we're eligible, once we know we're eligible, where do I go to get the vaccine?
So thank you for having me. Once you're in the right phase, and as Dr. Prabhu mentioned, we are in phase 2. At the beginning of phase 2, I should add, where people over the age of 75 are now eligible. You should also remember that people who are already in phase 1, they'll continue to receive the vaccine. So if you're a healthcare worker, for example, then you're still eligible to get the vaccine if you haven't gotten it already. But there are some websites created by the Mass Department of Public Health, and if you go to Massachusetts .gov COVID, then you will get this website where you can actually put in where you are, and there's a map, and then there's a search system where you can see where the doses are available. A short link to that could be massimmunizations.org, where all the sites are listed, and you can search by the day and which centers have availability. The system opens up on Thursdays in the evening, so that's your best bet to try and look up on a Thursday when the new allotment starts, and then go from there. There's also a nice map there that you can try and figure out which is closest to you. Now, the other way to do it also is, through your, Board of Health in your local town, where you can actually register and put your demographic data in there. And then you'll get an email or a notification of some kind when when there is availability and you can get, an appointment. And then the third way is, through your primary care physician and the health system that you're affiliated with. And if you register there, you will get a notification when your dose is ready for you.
Okay, thank you so much. So I think this would have been my first question, but the next question is really for Dr. Thakur. And thank you, Dr. Merchant, for your location guidelines. So Dr. Thakur, is it really safe, this vaccine, and does it really work?
Thank you so much for having me join all of you. So the vaccine is very safe. This vaccine, as for the history of vaccinations in the US, has been through the most rigorous testing process in terms of safety guidelines. And in terms of does the vaccine work, in the initial studies, it shows that it has actually worked very well in the Pfizer and Moderna studies. It showed that 94 to 95% of people who received the vaccine in the studies did not develop any serious problems with COVID. And interestingly, what we're just learning from the country of Israel, where they have now just reached a point of where they have vaccinated now a majority of their population, about 60% of Israelis have been vaccinated now. They're seeing a significant drop down in rates of hospitalizations in serious COVID infections. And so this looks extremely promising for the vaccine. I think one thing that's really important and a take-home point that we would want everybody to walk away with from this is, even after getting the vaccine, right now it's really important to continue to wear masks and maintain physical distancing after you've completed the course of vaccination, because not enough people will have been vaccinated. And we still don't fully understand whether being vaccinated stops transmission of COVID from one person to another. What we do know is it stops you from getting very sick from COVID. So it's still really important to follow all of the social distancing and masking guidelines.
Thank you, Dr. Thakur. This is very helpful. Another related question we have, and Dr. Prabhu, if you could address that. The question is, what if I did not take a second dose as recommended on time of 21 days or 28 days interval, as you said?
So I get this question all the time, people asking, I have to go somewhere or I don't remember. I think there's, as per CDC criteria, it says there's a 4 days grace period. Like you can, even though it's a first day on a 21 day, you can take it on 17th day or after 25th day, those kind of things. There's a 4 days either side, you can take it early. And even if it is later and some reason you could not get, as long as you can follow up with your provider and take it later, because the first vaccine is supposed to cause some percentage of immunity, but the second one is going to give you 80+% of the immunity. The full immunity is from the second vaccine, after the second vaccine. So it's important that you must receive. Again, I want to tell, don't forget to follow up with that and make sure that don't miss your appointment. But at the same time, there is some flexibility with the vaccination time-wise. So 4 days grace period has been mentioned several times. So make sure that you get it in that time.
Perfect. Thank you, Dr. Prabhu. Actually, a very related question to that is, what if I took 1 dose of one vaccine and a second dose of another vaccine? I think it is in terms of, 1 dose of Pfizer and then switching to Moderna and vice versa.
So again, that's another very common question people are asking. General guidelines is try to take same dose, of the same vaccine, 2 doses of the same vaccine. It is not advisable, again, interchangeable, but other countries have different guidelines, but in US, it's well advised to continue the same dose of the vaccine. Because we don't know that much data is there with that information. So I would highly recommend to continue with the same vaccine on advised period time.
Thank you, Dr. Prabhu. Our next question is something Dr. Thakur touched on, but I would like Dr. Merchant, if you could please comment on, can I go out and socialize without wearing a mask after I'm vaccinated?
Yeah, the short answer is no. All right, so I know that's not the answer you're looking for, but the short answer is no, and I'll tell you why. Because these vaccines, Moderna and Pfizer now offer up to 95% of effectiveness, but there are still the 5%, which will have the disease, albeit milder form of the disease. There will also be people who will not have the symptoms or may have such a mild form of disease, but they still carry the virus and they can spread it to others. And then the last reason for that also is, as Dr. Prabhu mentioned earlier, the concept of herd immunity. We're still there are still, enough people until they're vaccinated, maybe, transmitting the virus to somebody else. Mm-hmm. And for those reasons, and again, social stigma. Because if you go to the grocery store and you're not wearing a mask and everybody else around you is wearing a mask, you'll create problems there, even though you're vaccinated. So, the safest thing to do right now is wear a mask, follow all the, regulations around this and just be smart about it.
Yeah, thank you, Dr. Merchant. So important, wear masks, save lives. And so my next question is for Dr. Thakur. I know with all this COVID, we had new symptoms with COVID, but now with we have new symptoms with COVID vaccinations. So if you can touch on this topic, what symptoms to look out for after the vaccinations, and what to do when I do get any of these side effects?
Yeah, no, that's a great question. And I know Dr. Prabhu touched a little bit about it on her slides too. So, you know, the expected symptoms after the vaccine will be some soreness in the arm or the site where you got the injection, possibly some redness, maybe even a swelling of a lymph node in the underarm. And then you can also get some symptoms sort of throughout your body. So fevers, chills, body aches. Those are all common symptoms related to the vaccine. What you should be looking out for is if these symptoms last longer than 24 to 36 hours. So if you have these symptoms or other symptoms such as respiratory symptoms, that's when you need to call your doctor. And if you do experience those symptoms within 24 to 36 hours of your vaccine, you can ask your doctor if it's safe for you to take Tylenol or Motrin, because that can often help alleviate the symptoms that you're experiencing.
Okay, thank you so much. Yes, that I do have a lot of patients who call me and they have aches and pains, and half of it is worry as well, I must admit.
Yeah.
Thank you, Dr. Thakur. My next question is to Dr. Merchant. So now that I'm going to be all vaccinated, what about my kids? We can't hear you, Dr. Merchant.
Sorry, I think I was on mute. You know, it depends on how old your kids are. So if your kids are over 16, you know, Pfizer is approved for 16 plus. Moderna is approved for 18 plus. And, you know, they will be eligible for vaccination, the general phase, which is phase 3, when it opens up to everybody else. Now, there are, you know, ongoing studies in children. So until that data comes out, you know, we cannot recommend, you know, anybody else, you know, younger than 16 getting any of these vaccines.
Thank you, Dr. Merchant. Another question, if I could ask Dr. Thakur, the question is, can I take the flu vaccine at the same time as COVID vaccine? We may still have few people, I think, looking to take flu vaccine too.
Yeah, I mean, it is still technically flu season, so that's a great question. So the recommendation is actually that you split the vaccines apart. If you still haven't gotten your flu vaccine and you will be getting your COVID vaccine, the recommendation is that you split them both apart by 14 days. But it is still okay to get both vaccines as long as you know, let's say you get your flu vaccine first, then you have to let at least 14 days pass before you can start getting vaccinated for COVID. And the recommendation, you know, at least for all healthcare providers, is that we all get vaccinated for both. And so that is still an ongoing recommendation. So if you haven't gotten your flu vaccine, that's also still important to get as well.
Perfect. Thank you, Dr. Thakur. The next question we have, maybe Dr. Prabhu, you can address this. On the similar lines, we spoke some, and I'm sure you all of you in healthcare go through this concern a lot. What are the quarantine guidelines if I come into contact with a COVID positive person after vaccination?
So the guidelines remains the same. You have to quarantine for 14 days, and good you're vaccinated, but you might get the infection. The initiative for vaccine is you might get the infection, but your body is ready to kind of fight the infection. So you're supposed to quarantine, wear mask, wash hands, all those, maintaining the distance and everything. And also that you might that way you are maintaining that infection and you're not passing on to someone else. So I would highly recommend follow all the guidelines so far put in place for if you're getting this infection after vaccination.
Thank you, Dr. Prabhu. I know we had a question on kids, and related question here is there any adverse effects on my baby if I become pregnant after vaccination?
So I remember
Dr.
this question being asked by several younger nursing staff. I think it implies to so many people. There are a lot of people out there very scared to take this vaccine for mainly this reason, because we don't know this is made up of, mRNA vaccine. Again, this is mRNA vaccine. It's not going to go into your cells and change the DNA. But as far as my knowledge, I'm not aware of any adverse effects on pregnant. And the studies, both Pfizer and Moderna, both had whoever the volunteer in that study have become pregnant and delivered. So we don't, as far as my knowledge, we don't have anything affecting baby so far. So I would say highly recommend, if you are in the phase, whatever phase, if you're healthcare, you're in a phase 1, you're pregnant, you might want to have a counseling, talk to your doctor and make a informed decision. And I would highly recommend have the vaccine as your turn comes in the phase 1 or 2 or 3.
Thank you, Dr. Prabhu. It's indeed a relief to know that, and very reassuring for everybody. I'm actually going to follow this up another question, Dr. Merchant, with Dr. Merchant. It's a little bit of a long question, so I'm going to go slow. It's a little technical also, so the general population needs to understand the question. So we have so many vaccines. This is about, does the AstraZeneca vaccine or Johnson & Johnson vaccine, which are both based on the recombinant vector virus technology, give better protection against the newer strains of the COVID-19 that have mutated and supposedly become more transmissible and virulent?
It's a great question. The simple answer is we don't know. It's not a apples to apples comparison. So, as you already know, Pfizer and Moderna have already been approved. And when they did their studies, last year, we didn't see the emergence of these strains, right? So by and large, the people who are in those groups, we don't know if they had any other strains or not. And what these trials have shown us that the efficacy was extremely good, 95%. The more recent ones, with Johnson & Johnson and AstraZeneca, Johnson & Johnson did a study which included, North America, South America, and also had a South African arm. So we have some data there. And from the data that we have so far, it shows that, it's pretty effective against, the normal strain that we were dealing with. But with the newer strains, particularly the South African one, it's not as effective as, it has been against the, I'll just call it regular strain that, we've been dealing with. Similarly, AstraZeneca, if you remember correctly, it's a tie-up with Oxford University. So a large part of their trial was done in the United Kingdom, where there's emergence of the strain. So they have some data to support that. Now, Moderna has, come out publicly and said that they're going to do another study, and there's an ongoing study now to see how effective it is against the newer strains, particularly the UK variety, which is the B117 strain. I think, from the data that we have available so far, it seems like, most of these vaccines will have activity against the newer strains, but they may be a little bit lower than they were for the original strain. It could be around, in the range of around 60% is, what the guesstimate is right now. So we don't have all the data available in short, but even with, a vaccine being 60% effective, that's still good if, everybody gets vaccinated. And sooner you get vaccinated now, hopefully will cut down on the emergence of newer strains or the more, difficult to deal with strains. So I hope that made some sense.
It did. Thank you, Dr. Merchant. It's obviously a very evolving topic, and more new things will come to light as time goes by. And it is when it's our turn, we need to get vaccinated to curb this. So I'm going to have another question for Dr. Tagore at this point. So how long is this vaccine effective for? And is like, once I get the vaccine, is there any way to test if, even if I'm still immune to this? When is it time for revaccination would be a question for the future. But am I immune 3 months down the road? Am I not?
Yeah, so I think it's kind of similar to Dr. Merchant's short answer to the last question, is that we honestly don't know yet. I mean, I think that's something that the CDC and and Moderna and Pfizer are actively studying right now. So we honestly don't know how long the vaccine will give us immunity for. What we do know is that immunity from actually having the COVID infection probably only lasts around 90 days. But the risk of getting sick from COVID and getting seriously ill so much significantly outweighs any benefit of getting the vaccine. I mean, what the numbers are astounding with how much the vaccine protects you from getting very sick from COVID. And since you can't protect or can't predict if you're that person that's going to get really sick, it's just better to be safe than sorry, even if we don't necessarily know how long the vaccine is going to keep us immune for just yet. And then testing, if it's worked. So there are what we call antibody tests available to test to see if your immune system has created the antibodies necessary to fight off COVID. But right now, the CDC, the tests, while they exist, can have a lot of false results. And so we don't actually recommend testing for antibodies to see if you've built it up in your system after getting the vaccine.
Thank you, Dr. Thakur. Another question I have, maybe Dr. Merchant, you could address. This is about the ongoing phase of vaccination. Why is Massachusetts not using a centralized system for signing up elderly for the vaccine? Those over 75, they are struggling to navigate a complicated website of multiple providers to try and find the appointments. Would you know of any plans to provide outreach and bring the vaccine to seniors?
Yeah, again, that's a great question because, unfortunately, it's in the hands of, the Department of Public Health and Health and Human Services. There is a website which is not entirely user-friendly right now. So, I'm the first one to accept it. And, I've tried to schedule, my parents, and it's not very easy, but it's getting better. So, massimmunizations.org, it's much easier. But we know that, a lot of people are not technologically savvy or internet savvy, particularly, our seniors. And, on Friday, the governor set up this, 211 call where there will be assistance in different languages and having people registered for their appointment. So that's a welcome change. There is some legislation out there which was filed, January 28th to make a lot of these things much easier, more centralized, sign-up system. This was a part of that, interestingly. And then, receiving text alerts, for example, when your vaccine dose and date is available. So, it's getting better, but we are not quite there. I think, this 211 system will be, it's a big welcome for us.
Okay, thank you so much, Dr. Merchant. And Aditi, did you have any questions left, or I can take the audience questions?
I will say, go ahead, take some question from the audience.
Okay, so I actually have a couple, and I'll leave it to Dr. Prabhu, Dr. Merchant, Dr. Thakur. You can decide who wants to take it. So people are worried about their younger children and kids who are younger than 16. When do they get the vaccine? And the other question is person with food allergies, if they have any kind of like peanut or whatever. Now we have so many food allergies. Can they get either Pfizer or Moderna? Do they pick and choose?
I'm comfortable answering the food allergy question. So yes, the short answer is yes. People with food allergies can receive the Pfizer or Moderna vaccine because there are no no components or protein components that the allergens to the food, they're not in the vaccine. The vaccine is actually all entirely engineered. So it's actually very safe for people with food allergies to take. And it is standard practice that once you receive the vaccination, you're actually observed for 15 to 30 minutes post-vaccination. So the only thing you should really let your, when you're getting the injection, sort of letting the provider know is if you've had a severe reaction to a prior vaccination in the past. And they will probably then keep you longer for observation. But otherwise, there's no reason you can't get the vaccine if you have a food allergy.
I'm happy to answer the first about the kids question. There is an ongoing study for younger kids, adolescent. There's a study going on now. They've been enrolled. Hopefully, we will receive some good response from that study. Correct me wrong, Dr. Merchant and Dr. Thakur. That's what I heard. And I've been trying to register my own kid to the this study. And it's some of them are local, so I would highly recommend. I'll wait. Gonna wait for that study data, and we should know soon. If anything to add, Dr. Merchant, if you want to add, Dr. Thakur, that's what I'm aware of. Yeah.
Yeah, I think you're right. And as I mentioned earlier, there are ongoing studies for kids. And we need to wait for those results to come and the data to be clear. Hopefully they're going to be extremely effective and safe, like we've seen with the adults, but you can't say that with certainty until you see it. So you have to wait for data. And I agree with Dr. Thakur about, food allergies, not really a concern. Even medications, if you're allergic to certain medications, not really a concern. The only time I'm worried about is if you've had an anaphylactic reaction, which is a very severe form of an allergic reaction to any other vaccine in the past, or if you are allergic with anaphylaxis to any of the components of either of these two vaccines, those are the conditions that you really need to worry about. Other than that, not really. Or if you have an anaphylactic reaction to something that's unknown, that you don't know what caused that, then I would be extremely cautious about it.
Thank you, everyone. Aditi, do you want to take the next question?
Yes, we have some more questions coming in the chat, and I will strongly recommend everyone, please post your question in chat window. And if you are watching on Facebook Live, please post it on IAGB Facebook Live too. We may have time to answer a few more questions. So something similar to you were saying about Dr. Merchant on allergies. The other question is, if patient is taking a medication for existing medical condition, and I see a specific question on penicillin, would you know what is the impact of vaccine, if any, on them?
If they're taking an antibiotic?
Yes, or some other medication, do they need to check with their PCP? Do we know anything about these?
Yeah, I don't want to give any medical advice on this, session, but, if you're taking an antibiotic, you're probably sick with some kind of an infection, and it's probably better to wait till that acute infection has passed away. But other than that, just medications, it's not really a contraindication.
With the penicillin, I want to say I'm severely allergic to penicillin. I took both the vaccine with the Pfizer, both doses. There hasn't been any problems, and I was observed only 15 minutes, like all other normal, other typical people. So I'm sure it's not an reaction. It's not something contraindication to give the vaccine. You can go ahead and have the vaccine unless you had some anaphylactic reaction to penicillin in the past. That's something you need to talk to your primary care physician and see what needs to be done.
Perfect. Thank you, Dr. Prabhu. Dr. Merchant, a question is specifically, you mentioned about Town Board of Health. Would you please share how to register to get on the Town Board of Health, as you have mentioned earlier?
So, I checked with my town I don't know of every town in Massachusetts, but I've looked at a couple of town websites and their Board of Health. There is an online form that can be filled out. The other resources could be, the local senior centers or Council of Aging, particularly because we're talking about a phase we're in, which is 75 and older. Those are the places to go. Or, mass immunizations, the Department of Public Health website. You can go and register there, or, you can please find out where the locations are. That's what you would do. And or the 211 number too, that's also an option starting, last Friday.
Sure. Thank you, Dr. Merchant. Another question, maybe Dr. Prabhu or Dr. Kosha, you can take. How long can I wait to get the second dose? And if I have completely missed the recommended timeline, do I have to start all over again?
If I could add, I think I kind of went through that in the question. There is a 4 days grace period. You can take earlier or later. First vaccination is going to give you certain percentage of immunity, and the second one is going to give you higher to full immunity. So I would recommend what's been said, just continue with the regular vaccine. You don't have to redo all over again unless there is new guidelines. At this point, you just do the second dose. And there is some text message or something. They keep reminding you, sending you text message. It's due on this date. So there'll be a lot of text message reminding you. Hopefully you'll not forget to take the dose. Dr. Thakur, do you want to add anything to that?
I mean, I think Dr. Prabhu covered it very well, but I think I've seen in other questions who are questioning whether or not you really have to take the second dose. And it is very important to take that second dose within the window that you are recommended to take it. I mean, most places are right after you're finished getting your first injection, they help schedule the second injection right on the spot. And it is actually important. It's just the way that the sort of the science of how our immune systems work, that you need that second booster shot to build up complete immunity for the way that this vaccine was designed.
Well, thank you so much. I know that some people are actually concerned more about the second shot than the first one. And it's probably because we need to just reassure them that it's the immunity that's building up and showing itself. So I have another question from the audience. It's about the vaccines and its FDA approval. So currently vaccines are under EUA. When do we expect full FDA approval?
So the full FDA approval takes, a little bit more time. There is no definite date when they will be, taken up for a full approval. Right now, I think the focus is on getting as many vaccines approved if possible, if the data supports it under a EUA, and then, it could be several months or even a year later that they get full FDA approval.
Yeah, I think part of what requires the full FDA approval is understanding how long the vaccine gives us immunity for. And so that's why it will be some time before there's full FDA approval.
Thank you, Dr. Thakur and Dr. Merchant. Another question on vaccine distribution, and I can kind of relate to it. We are going through this, and Dr. Merchant, you touched base. The question is, big hospitals are taking only their own patients, and small practices do not have the vaccine at their facility. So where do patients go in this case?
Yeah, big hospitals were naturally selected as depot centers because, I think it was touched upon earlier by Dr. Prabhu. There are some storage requirements for some, at least the Pfizer vaccine, ultra cold storage, minus 80 degrees, which, a regular primary care practice will not have the capability to do so. So, it was almost a natural selection to centers that had that ability to do so. And as you know, Pfizer was the first to approve who got the approval for the vaccine. And then Moderna is a little bit easier with storage and handling, but you still, each vial requires, has 10 doses. So you need to line up 10 people so as to not waste any doses. So there are some logistic concerns, but the good news is it's opening up more and more practices are getting it. You've probably seen in Lowell, they set up a location which Circle Health is, inviting people to come in and get vaccinated. And they said they'll start with their patients first and then open up to the rest of the public. So I think most of the health systems are kind of setting things up to do so. But you can also get it, say, at your local, CVS or Walgreens or Stop and Shop or Wegmans, as the supply comes. And again, it's the same website. You can go and check, when they get a supply. It's dependent on how many doses the state government gets from the federal government. There's an allotment system. And when that becomes a little bit more robust, which we are expecting about in a month's time, there will be a huge supply of vaccine available. Now, that supply may actually go up if, there are newer vaccines that receive approval. So J&J, for example, filed for EUA, at the end of last week. Mm-hmm. And that approval may come pretty quickly, and that, opens up the supply even further. So, it's a waiting game now, and I'm really encouraged that people really want to take the vaccine, which is great.
I just want to point out that if you're not a patient of those large health systems, then calling the 211 or going on mass.gov is how you sign up to get vaccinations at other sites, like at Gillette Stadium or at sort of the local CVS or Walgreens. That's how you'll get directed to those other sites.
Perfect. Thank you, Dr. Merchant and Dr. Thakur. And I will maybe, just echo the thought there. This is all kind of coming together. We are very excited. At least we have these vaccine, and today, hopefully, our doctors are addressing many issues, and kind of, it's encouragement why we should take these vaccine. So I will take maybe a few more questions here. One question we have, Dr. Prabhu, you addressed it a little bit on the pregnant women, right? The question is, we have young couples who worry about pregnancy, fertility, and any long-term side effects. Do we have any data?
Again, I'm going back to what I said earlier. It's very important that it's an mRNA, genetically modified. It's not a DNA vaccine. It's not going into the nucleus and changing the things. So I would highly recommend all women who's planning to become pregnant or pregnant should take it. I'm not aware of up-to-date data, but again, going back to studies, there were thousands of people who had vaccine, and many of them become pregnant and had babies. Again, flip side of this is if the pregnant woman gets this infection, they can have severe consequences, like including, high fever, losing, preterm delivery or loss of baby, miscarriage, and things like that. So if you have to weigh benefit and risk, I would highly recommend when it's your term, phase 1, 2, or 3, talk to your doctor, have a counseling, and go ahead if you decide to go ahead. I would highly recommend. This helps in getting a herd immunity done, and this is not a new vaccine. There's been a lot of viral vaccines in the past. This is a newer one, yes, but I highly recommend people to go ahead and take vaccines.
Thank you, Dr. Prabhu. And I actually had this question myself too, but I saw it in the audience as well. Like, we have so many centers now giving out the vaccine, CVS, Walgreens, everybody, but we do want to monitor the patients for a little bit time, just in case of an unknown anaphylactic reaction. And like now with the drive-through vaccinations coming on the scene as well, like, how do they monitor this? How do I feel secure that I'll be watched properly by somebody who is qualified?
Yeah, I think I would have to,
Nobody
I can't admit that I know sort of specifically the process for the drive-through vaccination sites. I mean, I would imagine, at least I know for Newton Wellesley, when we have been developing our vaccination clinics, that there has been a lot of thought put in this, and we even have process improvement experts sort of working on how to make sure that each step is appropriately met. So I would hope that these drive-through areas are done with large parking lot areas available where you're stopping and somebody may be walking around checking in. I'm not sure myself how that's actually being implemented.
Just to piggyback on what Dr. Thakur said, yes, in Newton Wellesley we had, no people who had no history of allergies. We monitored them for 15 minutes, and the rest who had allergies for 30 minutes, and that's what's been done. I can hardly imagine how they could do in a park, in a drive-through, but it sounds right. Maybe in a parking lot they can be monitored. People can go to each car and check. I'm sure it can be done. Why not? Maybe gets the vaccination faster to people.
But I would recommend that when you're, signing up for a vaccine, and if you were thinking of going to a drive-through area, that would be a question to directly ask so that you feel safe receiving the vaccine.
Yeah, I agree. And maybe take somebody who can drive you back home too, just in case. I see Dr. Mupana, who is actually our past president and a pulmonologist. She's here as well. Welcome, Saras. So,
Great. All right. Thank you so much. At this point, I'm just watching the time. As I mentioned in the beginning, I think this is a topic we can go on and on and on, and we have many more questions. I would like to take this opportunity for all of you who came with your questions, and I hope, we along with our doctors panel could answer some of your queries. I would like to thank all the three panelists. You are our heroes, right? Along with all the frontline workers this past 1 year working through this COVID. I would also like to thank Dhruv Shah from Iman and Sanjay Gowda from IAGB. They are working behind the scene today and making sure, we are bringing this event to you. Thank you to both for your partnership. This was a great community event. I learned a lot myself today. With United India and these organizations, we will continue to come back to this sort of events. We are watching this COVID pandemic closely. I can say specifically with United India, we have changed our programming. It was all about culture and celebration, but the time demands, so whatever our community needs for, we will continue to bring this programming. So thank you so much for joining. May I ask all three panelists to give some concluding remarks, maybe 30 seconds each, please?
I'm going to go first, maybe, because I joined, I accepted from Aditi this United India Association Vice President job, and this has been a great thing I have done. And because my nature is to help, I've involved in a lot of NGO organization working through Rotary, and this is a crown in my project joining this United India Association. So I'm thank you for helping Dr. Merchant and Dr. Thakur. I look forward to joining you two to more of these kind of things and helping our community in coming days. Thank you so much being there today, and all the participants. Lovely questions and great questions. Got me thinking. Thank you.
Thank you, Dr. Prabhu. Dr. Thakur, would you go next, please?
I want to just thank you all for inviting me to join this. And Dr. Prabhu sort of flagged me down in the hall at work. And I'm more than honored to help. And I just think that this is an opportunity for all of us to not just contribute to our own specific Indian community, but our community at large, our country community, our world community, by seriously considering getting vaccinated, because this is how we will get each other through this pandemic.
Thank you, Dr. Thakur. Dr. Merchant.
Yeah, thank you so much for, it was a pleasure being here. Thank you so much for inviting. And, some great work by Iman, by United India and IAGB. It's great to have these organizations around. And this is, I've enjoyed, this discussion today. But I still see vaccine hesitancy. And we've seen that these vaccines have been extremely effective and very safe, other than a few side effects, which are very short-lived and mild in most instances. So protect yourself, protect your family, protect your friends and loved ones, and then do your part for the community. Because if we want to see the end of this pandemic, this is the way to do it. So I'd highly encourage everybody to do their part in this and protect yourself. You're doing it for yourself first.
Thank you.
Dr. Gupta, you have anything before we close the session today?
No, I thank you, Aditi, and Sanjay Gowda, and everybody here, all the panelists, all the doctors, because it's important. And Dr. Merchant said it correct. We still see a lot of hesitancy, and hopefully after this, we will go out and have more increased rates of vaccination, because that's the best way to protect our families and loved ones too, besides the mask. This is a huge step forward.
Great. Okay, everyone, keep washing those hands, wear the mask. Let's get through this. Let's go to that beach Malini showed us the dream for, and enjoy our vacation like old times. Thank you so much for joining, and bye-bye.
Thank you. Bye.
Thank you. Bye-bye.
Sanjay, you will have to end the meeting.
Yes, we are off the live.
We can stay if we're off the line, right, Aditi?
Yeah. Please,
Oh my
please.
God.
Dr. Kosha, thank you so much for your help and joining today. You should have something sent to your office on Monday to say thank you. And it's really honored to have you here today with us,
Oh no, my pleasure. I'm so thankful you asked me, and I was talking to Malini earlier today. I'm sorry that the past 2 weeks have been hard to get in touch with me. It's been pretty rough, busy weeks, but I'm more than happy to help and to volunteer my time. This is so important, and I think, as Asif pointed out, the vaccine hesitancy is a major issue.
Sanjay, it says it's still recording. It's still recording. Oh.
Yeah, that is from beginning to end. Once we end the conversation, I think it will go. Yeah. So anyway, that's going to be with only Drumil. So Drumil, hopefully.
Yeah, I usually edit that away. Don't worry.
Yeah.
And Drumil, I really wanted you to talk. I hope that you will say something, and we didn't have much to.
I don't. My voice is not as good right now, so.
Malini, Dhruv has promised us he will now have to do one more event together. I just feel so bad. He did so much work, and actually, Dr. Kosha,
everything. Dhruv, thank you so much. That was.
It worked out good. I was just looking at the waiting room. I think everyone's gone. I had to move. Yeah. So besides us, I think 5 of us are here. I think Seema is not here. Seema is already left.
Okay.
Okay, that's fine. Yeah, no, I think the event went really well.
Yeah.
No, thank you guys. I think thank you for taking the time. I think it's no one likes to take away the time on a Saturday from family, but I really appreciate you guys coming together. Thank you.
Kosha, on our unit, psychiatry, none of the nurses wanted to go for vaccination. That's when I came up with this presentation, and they all signed up the same day. And I had gotten already my first dose, and I said, look, I'm working, I'm here. So that was the first day, first dose I got it. So. All right. Thank you. Bye.
Okay.
Thank you. Thank you, Malini. Thank you so much, Dr. Kosha. Bye-bye.
Welcome. Bye.
Feel better.